During Module 1, we were required to find a minimum of 3 evidence-based practice resources from within the past 5 years to support our chosen teaching topic. I chose the topic of preventing falls in a hospital setting. I work on a med-surg unit and deal with all types of patients. I want my patients to remain safe, but even with some of the necessary precautions in place already, we experience falls. I want to research ways to help prevent this from happening. I want my PowerPoint to be informative for my classmates and show ways they too can prevent falls. Within this module, I have found 4 evidence-based practice resources from within the past 5 years on my topic of preventing falls in a hospital setting. During Module 2, I created a voiceover of my Preventing Falls in a Hospital Setting PowerPoint and 4 post-test questions for registered nurses who work in numerous communities in Arkansas and other states. The PowerPoint voiceover contained information on how much a fall cost, risk factors of a fall, prevention interventions, and how post-fall huddles are important. Between Module 3 and Module 5 was the time frame to post in the group site the voiceover of my Preventing Falls in a Hospital Setting PowerPoint, along with the post-test questions. I posted it on the due date, hoping to get the feedback needed for the next module done early. After my classmates read/listened to my PowerPoint, they will be better informed about falls in the hospital and ways they can help prevent them as the nurse and keep all our patients safer. Before the end of Module 6, I assessed the effectiveness of my voiceover PowerPoint on preventing falls in a hospital setting by retrieving and analyzing my classmates' answers to the post-test questions. After the analysis of my peers' answers, I will share the effectiveness of my PowerPoint in a brief 2 to 5 minute video myself, as I'm doing now. I describe step by step how I met each objectives and the overall goal, what my project content covered, analysis of measured outcomes, and how the community may benefit. I posted this video and completed project in the designated Dropboxes. This completed journal is the text of the video explaining IPP, content, questions, project outcomes, and references. So, analysis of my questions. Question 1, I asked, what is the prevalence of falls in hospitalized patients? 1, 10% of hospitalized patients. 2, 3% of hospitalized patients. 3, 7% of hospitalized patients. 4, 5% of hospitalized patients. 5, 4% of hospitalized patients. Of 7 answers, 1 said number 4, 6 said number 2, which is correct. So this question had 85% correct. Question 2, how much does a fall with injury cost on average? 1, $14,000. 2, $20,000. 3, $24,000. 4, $4,000. 5, $10,000. Of 7 answers, 7 said number 1, which is correct. So this question got 100% correct. Question 3, which of the following are risk factors for falls? 1, age. 2, histories of falls. 3, antidepressant use. 4, cognitive impairment. 5, all of the above. Of 7 answers, 1 said number 3, 6 said number 5, which is correct. So this question got 85%. Question 4, which of the following is an intervention for preventing falls? 1, ignoring patients' call lights. 2, not using sitters. 3, re-education for nursing staff. 4, ignoring bed alarms or waiting to see if it goes off on its own. 5, not using fall risk signs. Of 6 answers, 6 said number 3, so this one got 100% correct. And this is the end of my video that I will post in the correct Dropbox.